Right now, kids across the U.S. are dealing with the flu, RSV, COVID-19. I guess really parents are dealing with it as their kids are getting sick. The triple-demic, as it's being called, is straining pediatric hospitals, doctors' offices, and urgent care centers. Now some parents can't find kids' Tylenol or kids' Motrin. Pharmacists say fever-reducing drugs are in short supply because cold and flu season is hitting harder and earlier than ever. So what do you do to protect your kids? Dr. Krupa Playforth, also known as the Pediatrician Mom, is joining us live from Virginia. Dr. Playforth, straight away, what should parents do if they cannot find the medication they need at the store?
So there's a few different things. There are three big ideas that I like to share with parents if they're having trouble finding their medication. The first is you can try a generic version or a different brand compared to what you usually buy for your child. So there are some newer brands like Genexa and KinderMed that have acetaminophen and ibuprofen products. You can also try a store brand. Those products are equivalent and just as effective. So those are good options. Second thing you can do is to try a different child version of what you normally buy. So for example, if you usually buy children's ibuprofen, you could try infant ibuprofen. The thing to know about ibuprofen in particular, though, is that the concentration of infant is different than children's. So you want to make sure that you are using the correct dose because the volume that you give will be different. I have dosing information on my website, thepediatricianmom.com, and your pediatrician can also help you with dosing. You can also try a different child version in the sense of choosing a chewable tablet for a child who is 2 and up who you think can handle a chewable tablet, or even a suppository form. And then the third thing you can do, this is not available across the country, only in some areas, but you can even find out if there's a compounding pharmacist in your area that can compound the medication to make a child version for you if you're really struggling.
What about adult versions of medication? A lot of times parents just cut the pill in half. Is that too much? Is that dangerous?
This is not something I recommend. If it's something that somebody's interested in doing, they really need to talk to their pediatrician. But the truth is, medications like ibuprofen and acetaminophen are safe when given in the right doses. But if you're doing something like opening up a capsule and giving your child just a portion of it or trying to cut a pill, the risk is that you overdose your child, and that can be fatal. It's not something I recommend.
And in terms of home remedies, a lot of people do things, that are family traditions. They put a vapor rub in tea and they drink all kinds of concoctions. Do you have any that would actually work and that you'd actually condone?
The data isn't really there for a lot of those products. And what I worry about is that, particularly with homeopathic supplements, over-the-counter supplements, those are not regulated. And so we don't know what the safe doses are for children. They're not usually safety tested in children. And sometimes what's in the pill bottle or in the liquid medicine is not really what is on the label. So we don't recommend this. I know how tempting it is. I like to remind parents that fever is not dangerous. We have this fever phobia culture, and it is scary when your child has an elevated temperature, but the fever is the body's way of fighting the infection. So your goal when your child has a fever is to keep them comfortable and to keep them hydrated. Now, there are certain specific circumstances where a fever does mean a trip to the emergency room, for example, in a child under the age of 2 to 3 months, in a child with an underlying health problem, and you want to talk to your pediatrician if you think your child is in that category. But for the vast majority of kids, focusing on bringing the number down and not on looking at the child as a whole is kind of losing the forest for the trees a little bit.
Dr. Playforth, thank you so much. I think a lot of parents just need a reminder to talk to your doctor. We appreciate it.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.